The objectives of this training are to provide an update, to receive information on recent HIPAA and security issues and the corrective actions taken to address these issues within the Public Health Department, to increase your awareness around cybersecurity, and to identify how to report compliance, privacy, or security issues. And for those that just can't get enough of this information, we have ways you can get more information and get your questions answered.
This slide spells out the HIPAA training and administrative requirements for the public health workforce, as well as business associates working with PHI on behalf of the Public Health Department.
Protected health information can be either in hard copy or electronic form and includes sensitive personal health information. Protecting PHI also helps prevent identity theft, as breaches containing social security numbers, patient name, and other personal information can lead to identity theft. A formal breach assessment process is required by law and will be described in greater detail throughout this presentation. This slide explains about the penalties associated with HIPAA violations. Under civil penalties, up to $25,000 per event, improper disclosure of PHI, may be assessed. In addition, HIPAA carries criminal penalties that could be up to a $50,000 fine and up to 1 year in prison for knowingly obtaining and disclosing PHI. The fines and imprisonment accelerate quickly depending upon the severity of the act and the intention to profit from the disclosure of PHI. There have been recent cases in Los Angeles where several staff members were discharged because they violated their internal policies and HIPAA to review patient information on celebrities being treated at their healthcare facility. The county is required to notify patients of its policies on safeguarding PHI and does this through its Notice of Privacy Practices. These must be posted on the PhD Internet and must be available to all staff and patients. This is a review slide to remind us about the major elements of the Health Information Portability and Accountability Act, commonly known as HIPAA. It is our responsibility as service providers to safeguard protected health information, or PHI, as defined in HIPAA. This is information such as patient demographics, social security numbers, or information on even receiving any medical services with PhD. We need to be constantly vigilant to ensure the information in our systems is accurate, to ensure proper treatment, proper contact information, and proper billing. Be sure to prevent patients, family, and friends from seeing other patient information, whether this is in hard copy form or displayed on your monitor. Don't leave eligibility information, treatment information, patient labels, etc. laying around for others to see. When leaving your desk, put PHI in your desk drawer or turn or cover your desktop. Only discard PHI in shred bins, not regular recycling bins, as regular recycling bins are not secure and others can access this information. As defined here, a breach is the unauthorized release, whether intentional or unintentional, of PHI. If a breach occurs, PhD is required to notify the patient as soon as feasible and also to report the breach to the Department of Health and Human Services, OCR. This slide is meant to remind us that we all must work together to ensure HIPAA compliance. Every one of us has a role in reporting and preventing violations. If you have any doubts whether or not a violation has occurred, please contact your supervisor, the privacy officer, or the compliance officer. Anonymous and confidential reporting is available to you through the PhD Compliance Program.
Remember, when working with sensitive information, it is crucial that we stop and think about privacy and security risks. A few examples of those can be found on this slide. In this day and age, where many of us are constantly connected online and through social media, it is crucial that we remember that an act does not have to be intentionally malicious to have consequences. Please review the following incident to see how a social media post can violate someone's privacy. It is important to remember that while HIPAA and other privacy laws protect patients' medical information and clinical records, they also serve to protect their image. Taking unsolicited and non-approved photographs can easily constitute a breach. Remember, our patients' privacy is extremely important. Public Health Department employees and staff should never photograph, record, or videotape activities or individuals without explicit written consent and approval from the risk management team. We should also encourage patients and visitors to not take photographs at our facilities unless they can guarantee everyone in the photo or video has agreed to be a part of it. Again, we encourage Public Health Department employees to stop and think. Below is a list of things to consider before deciding to take a photo. While this list is not exhaustive, it's a good place to start. Failure to follow protocol regarding security surrounding PHI can have consequences for large groups of people as well as the organization found at fault. Please review the following scenario that initiated a corrective action plan and policy change within an organization in response to an issue. The following items are examples of risks for PHI use and storage. As the way we do business and communicate changes, the Public Health Department is working to address alternative means of communication.
We value our clients and patients. Valuing clients and patients means that we recognize we are here to serve. We do all we can to identify and meet their needs. We treat each person with respect, dignity, courtesy, and understanding. We deliver culturally sensitive and respectful service in a friendly and helpful manner. To help you identify possible privacy breaches, please read through these scenarios that have occurred here at the Public Health Department over the past 2 years. Here are some more examples where protected health information has been put at risk, in some cases by not following the PHD's secure email protocol. Cases involving electronic protected health information trigger a security investigation first, and then, if determined to be a breach, a full privacy investigation.
Investigation of a privacy breach must be thorough and can be time-consuming.
The Public Health Department's compliance program ensures that a suspected breach must be investigated and assessed to determine if it has occurred. The Public Health Department privacy and security officials work with the compliance officer to investigate and make these assessments. The county's privacy officer is now Ivania Newby, who can be reached at 934-6362. She and the Public Health Department's privacy and security officers now meet regularly and work collaboratively. It is critical for all staff to be vigilant and to report any suspected breaches. This can be done directly to the privacy or security officer or to the compliance officer. This can also be done anonymously through the compliance program's anonymous reporting mechanisms. For more information about reporting, please see the PHD compliance plan. This slide shows the number of impacted individuals is increasing due to the use of electronic protected health information or electronic health records in just 1 year.
This year, the EPHI trend has expanded to include incidents with cell phones, cameras, and social media. The Public Health Department is also concerned about breaches caused by Public Health Department contractors or business associates. Email with PHI that is not sent via secure email continues to be a problem and results in breaches. If you're sending PHI outside the Santa Barbara County's Outlook email system, even to another healthcare provider, you must use secure email. Just prepare the email as you would normally in Outlook, but in the subject line type secure in brackets without leaving any spaces. That's all you need to do to avoid a problem.
Steps to keep a clean machine. Validate the identity of anyone asking for confidential information. Don't open emails from strangers and don't click on unfamiliar sites. Make sure you change your passwords often and avoid using the same password on multiple sites. Always enter the URL by hand instead of following links. Report suspicious or unsolicited emails from unknown sources to the IT help desk or the security officer. Report any strange pop-ups or behavior by your computer to the IT help desk.
Here are some additional resources regarding security and PHI.
How do we know if our safeguarding has been effective and no breaches have occurred? To verify this, we must monitor and audit our processes. Monitoring is the ongoing day-to-day review of operational data and access to PHI. Auditing is a snapshot in time of the safeguarding of PHI. As this slide indicates, to comply with the HIPAA Omnibus Rule, we may only access the minimum amount of PHI necessary for us to treat our patients or to prevent communicable diseases. Auditing and monitoring help us to verify that our staff are adhering to this policy. Random spot checks are necessary to ensure staff are clear about what PHI they can and cannot access. It is also required to ensure that PHD can verify that their staff members are not accessing PHI inappropriately. Luckily, with the implementation of an electronic health record, we can use technology to quickly run reports to review these audit trails. Each program manager and program administrator is responsible for auditing their staff's access to PHI. However, the PhD privacy officer, in coordination with the PhD security officer under the compliance program, are responsible for auditing staff that access the EHR. If these audits reveal breaches or suspect information, the privacy and security officer are responsible for initiating and conducting an investigation to determine if a breach has or has not occurred. Let's look at a couple examples of violations of the PhD's policies relating to safeguarding PHI. In this example, 2 staff members violated security policies. The first staff member left his or her computer unattended, but not locked or turned off, and another staff member was able to use their session to gain access to PHI they should not have been accessing. In this case, care for the staff member's family member. Both could be subject to disciplinary action and possible penalties if the PHI was disclosed to an individual outside the county. Another example is looking at more information than requested or directed. In this example, an employee uses her access to the EHR to look at patient outcomes not under her care or the care of the primary care provider she supports. Both these examples can be determined by the use of EHR reporting and analyzing audit reports out of the EHR for staff access to PHI. As shown in this slide, there are many ways to report privacy or security violations. We encourage all staff to report this information confidentially using Form HCS 535 found on the county intranet. Once completed, submit the report to your supervisor, the privacy officer, or security officer. With your contact information, we can follow up with you for any clarifications and on the outcome of any investigation. However, if you want to report anonymously, you may also use the Compliance Program Reporting Form on the PhD website at www.countyofsb.org/PhD. In either fashion, you are protected from harassment in reporting these violations by the PhD's anti-harassment discrimination policy as outlined in the PhD's compliance plan. To summarize this training, the HIPAA Omnibus Rule modified elements of HIPAA and the HITECH Act to strengthen protections on the safeguarding of PHI. As a result, staff are cautioned and reminded that their activities will be monitored and audited to ensure they are compliant with these new requirements. Protect your login and password information, and do not share this with anyone. Make sure PHI is safeguarded by following policies to lock your computer when not in use, return hard copy to proper storage when complete, and do not leave anything accessible at your workstation when you are not present. Review only PHI for which you have authorization and direction. Do not let curiosity cause you to review PHI that you should not be accessing. Our patients expect us to ensure we are trustworthy when safeguarding their PHI. Here's the contact information for the PhD compliance, privacy, and security officers. Please do not hesitate in contacting them if you have questions or need guidance. Thank you for attending this HIPAA Omnibus Rule update. Please make sure you complete the HIPAA Update Acknowledgement Form and send it to PhD Compliance Reporting at sbcphd.org.
In order to document completion of this training, you must complete an online evaluation or quiz using SurveyMonkey. You must achieve a score of 80% or higher. There are multiple choice questions. Please click on the hyperlink in this slide to access the survey. And if you're not able to access the survey through this hyperlink, you can cut and paste the hyperlink into your internet browser to access the survey. Those that fail to achieve an 80% should correct their answers and retake the evaluation immediately, or they'll be contacted to retake this test.